Welcome to this final StoryAid module on reflection. By the end of this module, you will have gained an understanding of reflection as a broad concept, reflective practice and theories, the benefits of reflection, and some examples of reflective cycles in practice. This module will introduce the concept of reflection and reflective practice and explore how to apply the concept of reflection in healthcare to promote humanistic care. What is reflection? Reflection is how we deal with experiences. We have an experience on which we then reflect. We then take action based on our reflection to deepen our understanding of the experience. So, what is reflection? Reflection is a part of learning and thinking. We reflect in order to learn something, or we learn as a result of reflecting. The term reflective learning emphasizes the intention to learn from current or prior experience. Ultimately, we'll learn from experiences, leading us to be better practitioners. Reflection is viewed as a teaching and learning strategy which creates a means by which tacit knowledge and knowledge based on theory can be fruitfully combined. It allows practitioners to be self-aware and critically evaluate their own responses to practice situations. Human nature means that we all make assumptions about people and situations. Taking a step back and reflecting can help you to challenge some of these assumptions and to see things from a new perspective. Here are just a few examples of barriers to reflection: organizational culture, environment, and motivation. So why should you use reflection? Well, it's a critical skill for healthcare professionals as it facilitates the development of interpersonal skills, self-awareness, and the ability to influence others towards positive changes. Here, we encourage you to pause the video and take a moment to reflect using the example on the slide. There are many different types of reflection. Reflection in action and reflection on action are just two examples outlined here. We will now discuss reflective models. There are many models of reflection. This is an integration of all models, but broadly processed the same, and we would encourage you once again to pause the video and study this slide. The GIBBS cycle of reflection is one of the most popular to help start reflective practice. Take some time and reflect on any incident or scenario where humanistic care was observed or not observed, and apply it to the cycle. There are some ethical issues and concerns when we reflect, especially with others. We need to be aware of confidentiality, right to privacy, informed consent, and professional relationships. It's important to note that reflection needs to be combined with critical thinking to be viewed as a valid learning tool. Healthcare professionals face a myriad of challenging, complex, and unpredictable situations that need appropriate reflective and reflexive processes. Being able to critically reflect on experiences allows practitioners to explore difficult situations and enables inquiry into thoughts, feelings, beliefs, and values. We will now wrap up the module. It's important to remember that there are various forms of reflection, such as self-reflection, guided reflection, and group reflection. All have different learning from them, but to engage in critical reflection, guided group reflection can delve deeper into learning and attitudes values and cultures of healthcare professionals. Reflective practice assists the healthcare professional to get to know oneself and the patient. It enhances the ability to convey a sense of caring and compassion and helps with the emotional cost of caring. Reflection can be an important tool to cultivate humanistic care. Self-reflection allows practitioners the opportunity to change the way your mind would look at the world around you and to be a lot more compassionate towards others who it might not be as easy to have compassion for. It's also important that students are encouraged to and feel safe enough to be open-minded and allow their attitudes, beliefs, and values to be challenged. This can be achieved through reflection on their own experiences and also on the experiences of others. Reflecting on the lived experiences of others is known to be an effective learning tool that can and should enhance or change our practice. As we've seen in other modules, stories can be used to stimulate and facilitate reflection and debate. Storytelling brings the whole person to the forefront and enhances the connection between patient and healthcare worker and allows the patient to be viewed in a holistic manner, leading to enhanced person-centered care. Reflective practice can be undertaken within an interprofessional group and can reflect around the concepts of humanistic care. It can lead to awareness of group culture, their values, and can further open discussions on how to improve care. Lastly, reflective practice can be a powerful tool to assist healthcare practitioners to critically reflect on attitudes, values, and culture and allow deeper knowledge by becoming more self-aware. It can aid in ensuring that care is person-centered and reflecting on patient stories. It can help promote humanistic care by critically reflecting on care. It takes time to get more experienced at being a reflective practitioner, but there are huge benefits both personally and professionally. Thank you for listening, and I hope you enjoyed this module and the whole StoryAidEU course.